Data can look clean and still be wrong, inconsistent, or measuring the wrong thing. CA is about knowing when your measurement system can be trusted. EA asks you to evaluate the validity and reliability of measurement procedures, but the chapter frames trustworthy measurement with three related ideas: validity, accuracy, and reliability. Validity asks whether the data meaningfully reflect the original reason for measuring the behavior. Accuracy asks whether the data represent the true extent of the behavior as it actually occurred. Reliability asks whether measurement provides a consistent picture of the behavior. In simple exam language, validity is right target, right dimension, right context. Accuracy is observed value matches true value, and reliability is same values across repeated measurement of the same event. The big warning is that these terms are related, but they are not identical. The measurement system can be reliable but inaccurate, and accurate measurement of the wrong behavior or wrong dimension can still produce invalid data. Valid measurement in ABA has three important elements. First, the procedure should directly measure a socially significant target behavior. Second, the procedure should measure a dimension of the target behavior that is relevant to the question or concern. Third, the data should represent the behavior under the conditions and during the times most relevant to the reason for measuring it. That means a measurement procedure is not valid just because someone collected numbers. If the team measures the wrong behavior, the wrong dimension, or the behavior at unrepresentative times, the data can be invalid even if the observer collected the data, followed the data sheet exactly. On the exam, listen for questions that ask whether the measurement procedure matches the real clinical or educational concern. Cooper identifies three major threats to valid measurement: indirect measurement, measuring the wrong dimension, and measurement artifacts. Indirect measurement threatens validity because it measures a behavior different from the behavior of interest and requires an inference about the relation between the obtained measures and the actual behavior of interest. If indirect measurement is used, the researcher must provide evidence that the measured behavior directly reflects in a reliable and meaningful way something about the behavior for which the conclusions will be drawn. Measuring a location that is ill-suited for irrelevant to the reason for measurement compromises validity. Measurement artifacts are data that give an unwarranted or misleading picture of the behavior because the way measurement was conducted. Common causes of artifacts include discontinuous measurement, poorly scheduled observations, and insensitive or limiting measurement scales. Measurement is accurate when observed values, meaning the data produced by measurement, match the true state or true values of the event. Accuracy matters because no one wants to make research conclusions or treatment decisions from faulty data. Accuracy assessments help determine early in an analysis whether the data are usable for experimental or treatment decisions. Accuracy assessments also help discover and correct measurement errors. They can reveal consistent patterns of measurement error, which can improve or calibrate the measurement system. They also help communicate the relative trustworthiness of the data to others. The basic process is to calculate how closely each measure or datum corresponds to its true value. On the exam, if the question asks whether the recorded number matches what actually happened, think accuracy. Measurement is reliable when it yields the same values across repeated measurement of the same event. Reliability should not be confused with accuracy. High reliability does not mean high accuracy. A measurement system can produce the same wrong value repeatedly, which makes it reliable but still inaccurate. Low reliability, however, signals a problem because it shows that at least some of the data may not be accurate. Cooper explains that assessing reliability requires a natural or contrived permanent product so the observer can measure the same behavioral events. Examples include rescoring essays or replaying and rescoring video recordings of behavior. On the exam, if the same event is measured again to see whether the same value is obtained, think reliability. Cooper gives a practical hierarchy for evaluating measurement quality. After ensuring the validity of what and how behavior is being measured, behavior analysts should assess accuracy whenever possible rather than reliability or interobserver agreement. If all measurements in a data set meet an acceptable accuracy criterion, then questions about reliability and interobserver agreement become unnecessary for those accurate data. When true values are unavailable, reliability is the next best quality indicator. If true values and permanent product archives are unavailable, interobserver agreement provides a level of believability for the data. Interobserver agreement is not a direct indicator of validity, accuracy, or reliability, but it is a valuable and useful research tool in ABA. The exam version is simple: validate first, assess accuracy when possible, use reliability when accuracy cannot be checked, and use IOA when the first two are not available. Human error is the biggest threat to the accuracy and reliability of data in applied behavior analysis. Most investigations in ABA use human observers to measure behavior. Factors that contribute to measurement error include poorly designed measurement systems, inadequate observer training, and expectations about what the data should look like. A measurement system that is unnecessarily cumbersome or difficult to use can reduce accuracy and reliability. Observers should receive systematic training and practice with the measurement system and should meet predetermined accuracy and reliability criteria before collecting data. Observer drift means unintended changes in the way an observer uses a measurement system over the course of an investigation. Observer drift can be minimized with booster training sessions and feedback on accuracy and reliability. Observer expectations or knowledge about desired results can impair accuracy and reliability, and observer reactivity occurs when the awareness that others are evaluating the observer's data affects the data reported. Interobserver agreement, or IOA, is the most commonly used indicator of measurement quality in applied behavior analysis. IOA refers to the degree to which two or more independent observers report the same observed values after measuring the same events. IOA can help determine the competence of new observers. It can also detect observer drift. IOA helps judge whether the definition of the target behavior is clear and whether the measurement code and system are not too difficult to use. It also helps convince others of the relative believability of the data. Valid IOA requires two or more observers to use the same observation code and measurement system, observe and measure the same participants and events, and record behavior independently of influence from other observers. Percentage of agreement between observers is the most common convention for reporting IOA in ABA. There are multiple IOA calculation methods, and each gives a somewhat different view of agreement and disagreement between observers. For event recording, IOA can compare the total count recorded by each observer, counts within smaller intervals, or each observer's count on a trial by trial basis. Total count IOA is the simplest and crudest event recording IOA method, and exact count per interval IOA is the most stringent for most event recording data sets. For timing data, IOA for duration, response latency, or inner response time is calculated in essentially the same ways as event recording data. Total duration IOA divides the shorter duration by the longer duration. Mean duration per occurrence IOA is more conservative and usually more meaningful for total duration data and should always be calculated for duration per occurrence data. For interval data, the three common techniques are interval by interval IOA, scored interval IOA, and unscored interval IOA. Interval by interval IOA can overestimate agreement for behaviors that occur at very low or very high rates. So scored interval IOA is recommended for relatively low frequency behaviors, and unscored interval IOA is recommended for relatively high frequency behaviors. Here is the final C8 checklist. First, ask whether the measurement system is valid. Does it directly measure the socially significant target behavior, measure the relevant dimension, and sample relevant times and conditions? Second, ask whether accuracy can be assessed by comparing observed values to true values. Third, ask whether reliability can be assessed by remeasuring the same behavioral events through a natural or contrived permanent product. Fourth, ask whether IOA was collected with independent observers using the same code, same system, and same participants and events. Fifth, check for threats, indirect measurement, irrelevant dimensions, artifacts, human error, poorly designed systems, inadequate training, observer drift, expectations, bias, and reactivity. Six, make sure IOA assessments occur during each condition and phase of a study and are distributed across days, times, settings, and observers. Researchers should obtain and report IOA at the same levels at which They report and discuss study results. Recap: for CA, valid measurement means the procedure directly measures the socially significant target behavior, the relevant dimension, and representative conditions and times. Accurate measurement means observed values, match true values, and reliable measurement means repeated measurement of the same event yields the same values. To evaluate measurement procedures, check for threats to validity, accuracy, and reliability. Assess accuracy whenever possible. Use reliability when true values are unavailable. Use reliability and use IOA to increase confidence in the believability of the data.